Okay, we've established that the role of the coroner is to investigate certain kinds of deaths in order to determine the identity of the deceased person and the date, the place, the circumstance, and the medical cause of death. So you now should know that the coroner's role is essentially inquisitorial, to put together the pieces in the jigsaw puzzle and to make recommendations that will hopefully improve practice or systems or make a difference, essentially. But let's look at the types of deaths that are actually reportable. So, in what circumstances must a death be reported to the coroner? Well, doctors and other healthcare professionals, emergency service workers and police are under the statutory obligation, which is the Coroner's Act, to report the following deaths to the coroner. And that, for example, if the death was violent or unnatural, the death was sudden, the cause of it unknown, if it directly resulted or indirectly resulted from an accident or injury, following a health-related procedure, where the death wasn't causally related to the procedure, a medical certificate of death has not been signed, if the deceased hasn't been attended by a doctor in the last 6 months, if they were residing in a declared mental health facility, if they don't know the identity of the person, if the death occurred in custody, if it was in the course of or during a police operation, it was a child in care, or someone who was living in a residential centre or a disability centre. So there's a whole host of circumstances, they're very broad, where a death must be reported to the coroner. You'll recall that I recommended you really have a look at this website, the Coroner's Court website, because it really is very informative in relation to all things relating to the coroner's role, as well as, you know, giving information for healthcare professionals, and also handing down the findings so that they're made public. And I think it useful to look at some of the coronial findings because it relates directly to understanding the types of deaths that are reportable. So if we look at the 27 findings for this year that have come out, and when you click on the link, that takes you to the particular coroner who investigated the circumstances surrounding the death of Paige Bartholomew. And you can look at the catchwords. So this was obviously a death in custody, and it gives you, well, obviously because Paige died in custody, this was a reportable death, and so on. Again, missing person, death in police operation, another one, another death in custody. The ones that, and this one here, the case of the inquest into the death of David Brown, he died as a result of a boxing match. Some of you might be familiar, it made quite a lot of media coverage, that case, and so on. Another missing person. Now, this case here, inquest into the death of Alia Raftery, you can see that this is obviously a situation that it occurred in a psychiatric intensive care unit. So it's within the context of adolescent mental health, and obviously this will be a very sad case, but you can see some of the key words there, that, you know, risk assessment, handover process, ISPA, nurse to patient ratios, and so on. So just if we quickly have a look at that, the inquest itself is very easy to read, and again, they are great resource tools. Very sad in a lot of cases, but nonetheless, they do give recommendations and backstories for, you know, things to improve. So this is in the Hunter New England Local Health District, and there's the recommendations. I recommend that the Hunter New England Local Health District amend any procedures and policies regarding the transfer of patients between mental health services and units to include a mandatory requirement that patients are not to be transferred without agreement from a patient's consulting psychiatrist, and so on. There's a number of recommendations made, and those recommendations are then passed on to registering and governing authorities. Okay, and obviously the New South Wales Minister for Health there, and he tells you how, look, the Black Dog Institute, local health districts, and so on. And there's the table of contacts. So again, they're very patient or person-centered. You will find that, you know, they really are mindful that it's family who are really trying to discover what has happened in the lead up to Alia's death. So, you know, sometimes in law it can become very impartial, very, how can I put it, lack of caring. But with coronial inquests, you'll find that they really do have the person who died at the centre and mindful of who's reading this, and obviously the family. And this one is extremely comprehensive and will give you a good indication of all the facts that led up to Alia's death. Remember, it's inquisitorial, make recommendations to improve practice, and as healthcare workers we can certainly learn from this.